Page 3004. Module 1 Pre-Assessment Submission Quiz NIS 3025. Health Assessment XH 3004. Physical Assessment Across the Lifespan. Overview. For this performance task assessment, you will create a PowerPoint presentation on providing culturally competent care and the particular impact in the case of a physical assessment with an abnormal finding. Instructions. To complete this assessment, do the following. Be sure to adhere to the indicated assignment length. Download the PowerPoint presentation template. Download the academic writing expectations checklist to review prior to submitting your assessment. Before submitting your assessment, carefully review the rubric. This is the same rubric the faculty instructor will use to evaluate your submission, and it provides detailed criteria describing how to achieve or master the competency. Many students find that understanding the requirements of the assessment and the rubric criteria help them direct their focus and use their time most productively. All submissions must follow the conventions of scholarly writing. Properly formatted APA citations and references must be provided where appropriate. Submissions that do not meet these expectations will be returned without scoring. This assessment requires submission of one PowerPoint file in PPT format. Save this file as XH 3004 first initial last name. Responding to abnormal physical assessment findings with culturally competent care. One goal of this competency is to acknowledge your experience and to help you examine, interpret, and learn from it in ways that advance your nursing skills. This competency also puts priority on addressing aspects of nursing that are inevitable yet can be inherently challenging. With those goals in mind, your competency assessment requires an example of an abnormal finding in the physical assessment of a patient. You are encouraged to draw from your own experience. However, you may also work with a focus case obtained from another professional nurse. Consider details, such as the following, that you will need to provide. What was the purpose of the exam? How was the abnormality found? How was it determined to be abnormal? Was the abnormal finding usual, unusual, otherwise characterized, based the patient's age place in the lifespan? How was the finding shared with the patient? What were next steps for diagnosis and/or treatment? Explaining the role of cultural competence in nursing care is an equally important component of this assessment. You will analyze the impact of cultural competence in conducting a physical assessment and responding to an abnormal finding. You will explain how a nurse's demonstration of cultural competence would improve the patient's experience and potential outcomes. For these requirements, you may incorporate details about your focus patient that you know, or you may approach this part of the assessment by presenting best practices. Your performance task is to draw this information on cultural competence and physical assessment together in a PowerPoint presentation to inform nurses in a practice setting on providing culturally competent care and the particular impact with physical assessments that have abnormal findings. Be sure to adhere to rules of confidentiality and omit identifying details about the patient, healthcare setting, or other healthcare providers. Note: be sure to delete the formatting notes and tips in the PowerPoint template. Your presentation should feature only your original content and wording. To complete the competency assessment, using the PowerPoint template document, create a PowerPoint presentation of 14 slides, plus a title slide and reference slide to include the following. Part 1. Providing culturally competent care. Explain what cultural competence means in professional nursing practice. Describe examples of how culturally competent care benefits patients and patient outcomes. Explain practical approaches to demonstrating cultural competence, including cultural humility, in nursing care. Explain how knowledge of a patient's culture, including norms and beliefs, is important in a physical assessment, and why. Identify a patient who is the focus of your presentation with appropriate details: the patient's age, cultural background, health background, and purpose of the physical assessment. Part 2. Responding to an abnormal finding in a physical assessment. Explain what you found in the physical assessment of the patient, how you made the identification, and why the finding was abnormal. Based on the patient's age and place in the lifespan, explain how you characterize this finding and why. Explain how knowledge of the patient's cultural norms and belief supports presenting the abnormal finding to the patient. Explain your decision making on next steps for the patient. If you were making a referral for this patient, explain what you would consider and why. Explain the impact and value of this experience on your nursing practice with specific examples. Please contact Nursing Assignments Pro for help with XH 3004, Module 1 pre-assessment, or any other assignment. Email nursingassignmentsprofessor@gmail.com.